president of an organization called Direct Trust. And I'd like to make a few comments on the relationship between standards for health information exchange, the regulatory processes, testing, and accreditation. So let me begin by a very brief description of Direct Trust. Direct Trust is a voluntary nonprofit organization that is composed of approximately 130 organizations, many of them private sector companies, many of them health information exchanges and other state agencies. The common thread for the members of Direct Trust is to support the security and trust framework necessary for direct exchange to be useful in allowing messages to be both secure and to cross organizational IT boundaries in the near term, meaning 2014 2015. Direct Trust operates and has established a trust framework, an accreditation program for health information service providers who are providing direct services, and also operates a trust anchor bundle of other network services. As of the end of March of just passed, there were 26 health information service providers in Direct Trust who are fully accredited and audited or in the process of becoming so, who are supporting direct exchange of over 6,000 healthcare organizations in this country and have already provisioned 200,000 direct addresses. This is being driven largely by the onboarding process of hospitals and medical practices for stage 2 meaningful use. And as this audience is aware, you know that the electronic health record companies must be, if they are certified for 2014, must be direct capable. That is, capable of being both an origination point for a direct message and attachments, as well as a receiving point. I think this is a pretty significant accomplishment. Not many people know about it. And by the way, those numbers have doubled every 3 months for the last year. So we expect by the end of July we'll have over 500,000 direct addresses, mostly in the hands of providers and provider organizations. The point I'd like to make is that none of that would have been possible. None of this network that has been built for the secure, interoperable, identity-validated exchange of health information if it hadn't been for ONC initiating the direct project and developing the technical specifications for direct exchange. The private sector, namely Direct Trust, working with ONC under a cooperative agreement over the last year and a half on building out the framework for the secure and trusted exchange and the accreditation program. It wouldn't have been possible if ONC hadn't supported a Direct Trust with funding and also had helped us to develop that accreditation program so that it falls in line with federal guidelines around security and trust and identity. It wouldn't be possible if Direct Trust weren't engaging in the massive interoperability testing now that's going on between 28 HISPs around the country, which is now showing that about 90% of the time the exchange between direct addressee using one HISP is going through and being received appropriately by a direct addressee at another HISP. So I think that one of the things here that we want to pay attention to is when there's a private sector federal regulatory effort as successful as Direct has been, as Direct Trust has been, we need to pay attention to it. It's not making a lot of noise. It's not squeaky. So maybe a lot of people don't know that. But I think that it's important to emphasize that the standard's important, but the standard would not have been accepted by as a matter of fact, the standards have been for a long time kind of rejected by the vendors. Once the standard became part of the regulatory environment, that is, your EHR can't get certified unless you use the standard, the private sector really rallied around this. Every major electronic health record in the country is now either a HISP that is accredited by Direct Trust or is relying upon a HISP that is accredited by Direct Trust. And that reluctance on the part of the vendors has largely been overcome in a very short period of time, partly because of the persistence and support that ONC has given to the community. I think the community is paying back ONC by assuring that any professional in this country who wants to use direct exchange to securely move messages and attachments over this network will be able to do so. And I think that the full success of the effort will really blossom in 2015. Thank you very much.